As we were talking about colon hydrotherapy, I want to thank you for your comments. I want to thank you for the mere fact that you have been, educated and more knowledge, that you have received some knowledge from my teachings on colon hydrotherapy. A lot of times people are suffering from acid reflux. People are suffering from bloatedness, people have cramps. A lot of times people don't realize that when they develop appendicitis, is it because of a fecalith, which is stool seeping down into the lumen and entering into the appendix. That's why sometimes you'll hear, well, all the time you'll hear, they say that if it bursts, or if it's inflamed and it bursts, it could kill you because you develop septicemia or toxemia. All because of the feces that have entered into the appendix. I want to also make it clear that the knowledge that I'm sharing, it's not that I've just gotten up and done this overnight. I've been trained as a surgical technologist. I studied at the Lindsay Hopkins Technical Institute in Miami, Florida. Not only that, but I did my interns at Jackson Memorial, Baptist, Veterans Affairs, and Mercy Hospital. And so I have, as a matter of fact, when I attended Lindsay Hopkins Technical in Miami, Florida, within a few weeks I was also an assistant helping to teach anatomy and physiology in the classes. And so I'm quite knowledgeable. I came back and I worked at the Georgetown Hospital for several years in theater, and I've soloed on many cases, including exploratory surgery, where they go in and examine for maybe complications that the doctors cannot really pinpoint. I've also assisted in thoracotomies, appendectomies, herniorrhaphies, sigmoidoscopies, everything, every kind of surgery, heart surgery, eye surgery, babies, C-sections. There's hardly a type of surgery, laser, that I have not assisted on and continue to be abreast of. And so as a colon hydrotherapy, I am giving God thanks that I am quite knowledgeable of what I'm doing. It doesn't mean that I know everything, but I am not a novice. As I always like to say, colon hydrotherapy serves so many benefits. A lot of times people only point it to stool or constipation, but so many times persons are packed with bacteria. The ecology of the colon is no longer working the way it should. Sometimes people will criticize and say, well, you're washing out the good flora, the good bacteria. But to be honest, there's hardly one individual that has any good flora that is left in there because of poor elimination, poor eating habits, and because of this food, the water, all of the bad things that we have crammed in our systems over the years, not to mention the hard food, the sugars, and all of those things. And so I say to a person that by rights, the ecology of the colon is 80 to 20, meaning 80% good flora versus 20% bad flora. Majority of the population might not even have 5% good flora. When we do colon hydrotherapy, we're actually removing the impacted waste that is sitting there in the large intestine that is not moving the way it should. A lot of times, during my times of doing colon therapy, I have seen persons pass out peanuts, cashews, pimento seeds, food that they have eaten, some undigested food that they ate 3-4 days ago. Some of them have been in there for months, and it's just coming out because of the water going in and soaking the little crevices and the little areas, the little pockets in the colon. As I said before, and I'll say it again, common sense. You don't need no scientists to approve water being going into the system. Did you know that the colon sucks water? The colon is where the electrolytes and all of those things is being sucked and dealt with and sent back to the bloodstream. Why is it that when persons have diarrhea, that they try to give them electrolytes. Think about children and Pedialytes and all of those things. When you have diarrhea, they try to encourage you to drink as much fluids as you possibly can. What they do, they give you saline. Remember, I am speaking also from a nursing standpoint, so it's not something that I'm trying. I am a trained licensed nurse, practical nurse, and so my knowledge that is in my head, no one can take that away from me. You have to respect me for that. I am a doctor. I hold 2 doctorates, Doctor of Divinity. I am also a natural health practitioner, a natural health consultant, and a natural health technician. I did my studies through the Alternative Medicine College of Canada. I've also studied with Boris Berlusky out of New York, and I'm also trained in medical massages, reflexology, and I continue to study because knowledge is powerful. And so I want to say to you, the best thing, one of the best things that you can ever do for yourself is not just sit back and listen to everything what everybody's telling you, but take your own health into your own hands and look about yourself. Give yourself a series of colon therapy. Cleanse your system. It will re-energize you. It will rejuvenate you. It will cause you to feel cleaner and feel lighter and feel more healthier. And let me tell you something, whether you believe in colonics or not, it will not change my mind, and it will not hinder my progress to be more healthy. I am now over 50 years old, and I'm feeling great. I'm feeling good. If I had the knowledge that I had now, maybe some of the things that has happened to me over the years, even though I was in nursing, would not have happened to me. And so take your health into your hand, and whether you do it or don't do it, it doesn't bother me. The life that you save, the life that you help, could very well be yours or your children or your relatives or a good friend. So do your homework. Go online. Don't take my word for it. Go online, do your homeworks, listen, do some research, go and look at the benefits of colon therapy, go and look at the disadvantages. I always say, whenever you come to me, you're going to fill out forms. I'm going to question you and go through a thorough health education with you. And if I feel that you're not a candidate that is good for colon hydrotherapy, I am going to recommend that you go and see your medical doctor. Thank you very much.